Okay, so have you ever gotten a knee MRI report and it just left you totally confused and maybe a little worried? You see these scary words like lesions or defects and think the worst, but what's really going on?
So researchers decided to dig into this by looking at elite athletes, specifically Australian rules football players.
And what they found was kind of wild. A whopping 90% of them had at least one abnormality show up.
And we're talking common stuff. Bone marrow lesions, cartilage defects, you name it, these top players had it.
Here's a perfect example. You can see how a new lesion just pops up right after an injury happened.
But here's the kicker. For most of these findings, there was no real link to the player's actual pain levels. In fact, even players with zero pain or past injuries showed these so-called abnormalities.
Crazy, right? So, if the stuff on the scan isn't causing the pain, then what is? This is the big question.
Well, it turns out we might have been thinking about it all wrong. It's not a straight line from finding to pain.
Instead, an injury happens, and that injury causes both the pain and the changes you see on the MRI.
And this chart really proves it. Past injuries and surgeries are directly linked to these specific findings.
So a better way to look at an MRI is like a roadmap. It just shows the wear and tear of a career.
The main takeaway is this. These abnormalities are super common, but injury is the real link to pain.
Exactly what the study says. The scan doesn't actually dictate what a player feels. It's not the whole story.
It all comes down to context. An MRI is just one piece of a much, much bigger puzzle for your doctor.
Which leaves us with the real question. Should we treat the scan or should we treat the person?